Hello and welcome to our March edition of our monthly newsletter, in which we provide a brief update of some of the health awareness events during March. I'm Sabine McKenzie, Community Engagement Officer, and I'm here with Amanda Nash. How are you?
Good, thanks Sabine.
Good to hear. Now another month is gone, can you believe it?
No, March already.
Too quickly. Due to volatility of the COVID-19 virus, which still brings continuing changes in restrictions, we continue to take, of course, all reasonable measures to reduce the spread and severity of the virus and look on how we can safely restart our group activities. Is that right, Amanda?
That's correct. So it's great news. Our social support group and exercise classes are resuming with the COVID safety measures all in place. Updates and changes to that will be provided to the community and their clients and groups respectively when needed. Our allied health services like speech, physio, x-ray, private podiatry, women's clinic all continue as they have done with the same safety measures in place, strict government guidelines. There's screening and the social distancing rules all in place. That goes as well for theatre, respite services and dental. As restrictions have eased, the important message is still that every test help us to keep on top of the virus. Even so, if you have the mildest symptoms, the message is you need to actually get tested, stay at home until you get your results. Testing can be done at the health service by calling 555 86 000 or the Timboon Clinic by calling 555 86 088. We'll continue to provide you, our community, with the latest updates through our social media as they come through from the Department of Health and Human Services, including information on vaccines as they become available.
Yes, there will be some questions out there.
Certainly.
So we'll make sure that the community will be updated on our Facebook and social media. Now in February, TDHS joined FebFast. That's an Australian charity raising important funds, enabling young people who experience serious disadvantage to access the resources and support that they need to lead a healthy and fulfilling lives. It was a great success again, wasn't it, Amanda?
Yes, certainly. The community raised $687. And we'd like to thank staff and community members for supporting and donating to the wonderful cause.
Yeah, that's a fantastic result. Again, every year people seem to be able to want to give to the cause, so that's fantastic. We've just released our autumn quarterly, which has again stories shared by community members, reflecting strength, courage and hope in the face of challenge and adversity. It includes a Faye Tregay story talking about her journey with epilepsy, and that's highlighting Epilepsy Awareness Month, which is this month in March. Now, epilepsy can have a great impact on a person's life, can't it, Amanda?
Definitely. There's many different types of epilepsies and people's experiences differ greatly. But Faye's story shows that it can result in chronic sleeplessness and overwhelming sense of helplessness. So epilepsy is a common disease of the brain where there's a tendency to have recurrent seizures. It's a neurological disorder, not a mental illness. And seizures are caused by a temporary disruption of the electrical activity in the brain. Approximately 3 to 3.5% of Australians will experience epilepsy at some stage in their lives.
That's a lot.
And over 250,000 Australians currently live with epilepsy. Epilepsy can start at any age, although it's more likely to be diagnosed in childhood or senior years. Approximately 2/3 of people with epilepsy become seizure-free with medication. So it's important to get people talking about the condition and let those impacted by seizures know that they're not alone. There can be different causes, experiences and treatments. So more information can be found on the Epilepsy Action Australia website, or you can make an appointment to see a GP at Timboon Clinic on 555 86 000.
Yeah, very important message, isn't it, Amanda? Now, March is also called Melanoma March. Can you tell us a bit more about this campaign, Amanda?
So Melanoma March raised much needed funding for melanoma research, which celebrating survivors, supporting patients and remembering loved ones who have lost their lives to melanoma. Australia has one of the highest rates of melanoma in the world, but research is certainly making a difference. There are also 3 things that you can regularly do to reduce your risk of developing melanoma and increase the chances of detecting early, and that's the key. So protecting your skin from the sun, check your own skin for melanoma, or have a professional check it. It's important to get professional skin checked by a doctor if anything suspicious appears on your skin or if you are at high risk. Talk to your doctor about if and how often you should be getting a regular professional skin check.
Yep. Now, from the 1st of the 7th of March, it's Hearing Awareness Week, and Amanda, you decided to share your story about your waves of emotion regarding your hearing loss in our Autumn Quarterly. Firstly, thank you so much for sharing your story with us in the community. And but what made you to decide to do this?
I wanted to encourage anyone with hearing concerns to embrace hearing aid technology. My life certainly changed when I had my first set of hearing aids fitted in my mid-40s. They don't stop me from doing anything, and most people don't even know I've got them. I worry that people who don't do something about their hearing become isolated, withdraw from social interaction, and stop living life to the fullest. So Tim Rayner comes to Timboon District Healthcare every month, and appointments can be made by calling reception 555 86 000.
Yeah, I was just amazed with your story in the quarterly about how it opened up a whole life and sounds and everything, sounds of the ocean.
You don't realise what you're missing.
Yeah, exactly, which is amazing, isn't it? Well, thank you, Amanda, for highlighting some of the March health awareness events. And you can find a more detailed what's on at the back of our Autumn Quarterly, and you can find that on our website and through Timboon, Simpson and Paul Campbell. Thank you for joining us, and please check our social media for more health awareness events and information, and also inspiring community stories to show how resilient we are in our community. One health awareness we can all be part of is to please be kind to yourself and each other. We have an amazing community and we've come through it this far, and we will get through it together, and it is all up to us to keep us safe mentally and physically. So please stay apart, stay safe and stay kind as we work together for a healthy community. Thank you. Thanks, Amanda.